In this session of the Pediatric Emergency Medicine Fellows Research Design course, we will discuss presenting the results of your research project in posters and platform presentations. We have completed all the preparatory steps in the research process. We have asked and refined an answerable research question, searched the medical literature, selected a study design, subjects, and variables, completed the sample size determination, written and submitted a research protocol to the IRB, and possibly applied for grant funding. We have collected, managed, and analyzed the data and are now ready to disseminate it. The goals for this session is to describe the steps in preparing an abstract for presentation as a poster or a platform presentation. We will review how to structure the presentation and define appropriate content and layout for posters and slide content. Presenting your research is an opportunity to get credit and recognition for the work that you have done, display your work in public to your peers, discuss and debate with colleagues, refine and improve your study, and network with other investigators and potential collaborators. It is important to understand when national conferences occur and plan your research project to anticipate submission deadlines. These conferences can be divided into pediatric-focused or emergency medicine-focused. In pediatrics, there is the Pediatric Academic Society, or PAS, and the American Academy of Pediatrics, or AAP. In emergency medicine, there is the Society for Academic Emergency Medicine, SAEM, and the American College of Emergency Physicians, ACEP. Pediatric emergency medicine has a home in both of these. The conferences can be further divided into those with an academic focus and those with a more commercial focus, so there is considerable overlap. PAS and SAEM are considered the more academically focused conferences. These conferences are just the tip of the iceberg. There are many subspecialty conferences that may be appropriate to your project. These include local and regional conferences, conferences for simulation and ultrasound, and conferences for groups like the American Heart Association. This is a structured abstract. It includes the title, introduction or background, methods, results, and conclusions. We will review each of the components of these throughout this talk. Follow the instructions explicitly for the conference that you are submitting to. This is the SAEM criteria for abstract grading. In looking at this list, it is not surprising that these are the criteria we use in critical appraisal and the criteria that the IRB and funding agencies use to assess projects. The SAEM criteria include clarity, are the objectives clear? Approach, are the methods correct to answer the study question? Validity, are the correct outcomes measured, potential confounders managed well, and does the abstract tell a logical story? Analysis, are the statistics used correctly? Scope, is there a multi-center versus a single-center study? Relevance, is the topic important and innovative? And stage, is it ready for publication? So, how does this all work? You submit your abstract, it is reviewed, and if accepted, the reviewers decide if it will be displayed as a poster or platform presentation. Traditional accepted conference submissions are divided into posters and platform presentations. There is a bit of a hierarchy, with platform presentations being more prestigious than posters. Platform presentations are an opportunity to present your study in slide format verbally to an audience of your peers, followed by questions. Posters are typically attached to a board or a wall. During assigned times, you stand near your poster while attendees walk around and ask you questions and comment on your work. While this was done previously in person, it can now be done virtually as well. Virtual poster presentations may include a brief video description. Recently, there has been a hybrid model of verbally presenting your poster as well. For example, the PAS includes an oral poster symposium. 10 to 12 posters are grouped by topic. Following a 30-minute viewing period, short oral presentations, and a discussion period with questions from the audience is chaired by the session moderator. This session is divided into 3 sections: posters, platform presentations, and slide and poster content. First up is posters. A successful poster should attract the passerby. It should be visually pleasing and easy to read and follow. This includes a mix of text and graphics and consistent formatting throughout. It is helpful to have a handout with the complete abstract and your contact information to give to those that are interested. The most important advice is to precisely follow the instructions of the conference you are submitting to. The maximum size of posters is typically 4 by 8 feet. Determine the time and location for both setup and removal, and the time when you are required to stand by your poster. Sketch out your poster's layout with the title banner across the top. Plan for 10 to 14 panels maximally. Do not include the abstract unless instructed to do so. Clarity and legibility have priority over details. This is a sample poster layout. The title banner with authors and institution name and logo is on the top. This poster is divided into columns representing the introduction, methods, results, and conclusions. The arrows follow the progress of the content from beginning to end. This is the same sample poster from the previous slide with content of each slide panel listed. Essentially, it follows the same format you would using in writing a manuscript. The introduction identifies the problem, what is known and what is unknown about the problem, and your goals and hypotheses. The methods section describes how you intend to answer your research question. The methods also include a description of the subject, setting, and study design, definitions of the predictors and outcomes as well as potential confounders, and your analysis plan. The results column include a description of the study population, results for the primary and secondary outcome, preferably in graphic form. The conclusions columns include the limitations of your study, your conclusion, and potential implications. The panel should tell a convincing story in the order of hypothesis to methods to results to conclusions. This is the suggested format for the Pediatric Academic Society Conference. It closely follows the sample that we just reviewed. The PAS requires you to upload a single PDF file of your poster. A slide aspect ratio of 16:9 in landscape is preferred. Avoid using abbreviations, acronyms, and jargon. The font should be consistent throughout. Tables and images should be large enough for audience viewing. The poster should not include animations, videos, or copyrighted images. This is a poster created by a prior fellow. It is graphics-oriented rather than text-oriented. In retrospect, we could have excluded the abstract. These are important questions suggested by the PAS to answer prior to submitting your completed poster. What do I want the viewer to remember? Is the message clear? Do important points stand out? Is there a balance between words and illustrations? Is the pathway through the poster clear? Is the poster understandable without oral explanation? It is essential to have others not directly involved in your research review it and critique it. Are the reviewers' answers to the above questions what you'd want them to be? During the viewing session, be a good host. Greet and introduce yourself and your poster. Offer to succinctly walk them through the poster. Take the opportunity to network and collaborate. Talk to your neighbors. Look for session chairs and invited guests. Identify other researchers in your area of interest. Now let's move on to platform presentations. Platform presentations are academically important. It is an opportunity to hone your public speaking skills in front of a larger audience of your peers than for posters, and to obtain national and regional recognition for the work that you have done, as well as network. As for posters, it is essential to follow instructions explicitly. Slides are typically formatted in a 6:9 ratio. Determine where and when to upload your slides, and the location and time of setup for the presentation. Most presentations require a conflict of interest statement even if there are no conflicts to disclose. Presentations are typically 10 minutes, followed by a 5-minute question and answer period. Allot 45 to 60 seconds for each slide. In a 10-minute presentation, that means a total of 10 to 14 slides. Prepare additional slides to address anticipated questions. On the day of the talk, arrive early. Find and use the speaker ready room. Ensure your presentation is available and clearly labeled. Introduce yourself to the session moderators. Sit on an aisle near the podium to reduce disruption and time to get to the podium. Listen to the presentations prior to yours and refer to similar works if relevant. The title slide should include your collaborator's institution. Do not read all the collaborator names. Instead, state, I would like to thank my co-authors for. Start with, this morning or afternoon, I would like to present the results of our study on. Acknowledge any changes that have been made after the abstract had been submitted. These results differ from our printed abstract. We have enrolled 22 additional patients, or we have included a logistic regression analysis to identify independent predictors of our outcome. This is the same structure that we reviewed for abstract submission and that you will use to write your manuscripts. Practice several times while timing each presentation. Cut material until you are consistently on time. Find a sympathetic group who will listen and provide honest critique. This should include at least one person who is not familiar with your research. The first pass should focus on content, order, and clarity. The second pass should focus on form and flow and again on clarity. What questions did the group ask and how would you answer them? Bring a backup copy of your presentation file on a flash drive. Email a copy to yourself in case you lose the flash drive. Save your file in the most recent version of PowerPoint. If you're using Apple Keynote, determine if a Mac computer with Keynote is available. If you are using unusual fonts or symbols, embed them in your presentation. If you are anxious, and most people are, practice until you know the material backward and forward. Practice answering the anticipated questions. Use the restroom before you talk and have water available in case your mouth gets dry. Have friends in the audience a few rows back in your line of sight. Focus on them. Some take beta blockers. Take a test dose before your actual talk if you choose to take them. Some like to use a script and others prefer to be more extemporaneous. Reading from a script is not the same as reading your slides. Your slide should highlight what you're saying. Reading from a script may sound rehearsed or boring, but provides you with less opportunities for error. Speaking extemporaneously sounds less practice, but you may forget important points, go overtime, or wander off topic. If you are speaking extemporaneously, it never hurts to have a script to fall back on. Speak slowly and clearly. If you have too many slides, you will feel rushed. Face the audience, not the computer or slides. Be aware of your speech characteristics such as tone, inflection, pitch, volume, rate, likes, and ums. Be aware of your nonverbal behavior such as posture, gestures, eye contact, facial expressions, pacing, and fidgets. Record a video of the presentation to review your speech characteristics and nonverbal behaviors. You can't fix them if you are not aware of them. When presenting graphs, figures, or tables, orient the listener. For example, state, on this graph, the y-axis represents mortality and the x-axis represents time. Practice handling questions. Question, why did you not do the study that I would have done? Answer, that is an interesting idea, but not what we set out to study. Question, why did you not use statistic X? Answer, we did use statistics X and the results did not change. Or, that is an interesting suggestion, I will investigate that. Could there be confounding? We considered the possibility but decided it was uncertain because of. Or, that is an interesting question that we had not considered. Can the results be generalized? We are comfortable extrapolating the results to patients meeting our enrollment criteria in a similar setting. Or, we would be cautious about generalizing to all children until our results have been confirmed in other populations. How do you handle problem questions, such as those you don't understand? I'm afraid I'm having difficulty with your question. Could you please repeat or rephrase it? For the sake of time, perhaps we could continue this discussion later. What do you do if you don't know the answer to a question? That is a good and interesting question for which I do not know the answer. Two-part questions can also be difficult. Answer one of the questions. If you don't remember the other question, ask them if they could repeat it. We'll finish this discussion with a review of slide and poster panel content. At the rate of 45 to 60 seconds per slide, 10 to 14 total slides can be presented in 10 minutes. The introduction defines the problem, what is known and unknown about the problem, and sets up your research question and hypotheses. Subjects and methods should define the population of interest, your study design, and plan for analysis. The results should include descriptive and inferential statistics and are best presented as graphs and tables. What are the conclusions and implications of your study? What are the limitations of your study and how do they impact your conclusions? Place the conclusion in the context of the existing literature. This is not simply a repetition of the results. The good news is that the introduction, background, subjects, and methods are already complete if you wrote a good research protocol. Use high contrast colors for the slide background and text, and a third color for emphasis. For example, this slide presents black text on a white background with red for slide titles and emphasis. Avoid complex templates and animations. Use non-serif fonts which are easier to read, of at least 20 points. The first line below is the font Arial, which is a non-serif font. The second line below is the same phrase in the font Times New Roman, which is a serif font. Throughout this presentation, I've used Arial at 28 points for primary bullets and 24 points for secondary bullets. Slide titles should be descriptive and not simply numbered. Instead of results 1, 2, 3, and 4, demographic characteristics, primary outcome X, secondary outcomes Y and Z, and subgroup analyses. Keep the slide title to one line in a larger font and different color. Keep each point to one line if possible, in a font of at least 20 points and a maximum of 7 lines per slide. Use a word instead of a phrase and a phrase instead of a sentence. Present results in tables or charts. Use bulleted lists of words and phrases instead of full sentences. When you write in full sentences, you tend to read the sentences. The audience can read faster than you can speak and will stop listening. Display in words and phrases and state in sentences. The slide content should highlight what you are saying, not be what you are saying. Tables and charts present data in a compact form. Limit tables to less than 15 rows times columns, even better if less than 10. They should be readable from the back of the room and contain only essential data. Orient the audience to tables and charts. Define columns and rows for tables and the Y and X axes for charts. You should never have to say, "If only you could read this," or "I am sorry the text is so small," or "Ignore everything else but this." Here are 2 alternative titles. A randomized trial of D5 normal saline versus normal saline in the treatment of children with mild to moderate dehydration due to gastroenteritis, or the addition of dextrose to normal saline decreases the admission rate of children with mild to moderate dehydration due to gastroenteritis. In general, I find the top title to be the most common format, but prefer the bottom one that describes the results of the study. Both titles include the patients and interventions. The top title also includes the study design, but excludes the control and the outcome. The bottom title also includes the outcomes, but excludes the control and the design. The title slide should also include the authors, as well as the institution name and logo. Your institution may have a template to use for this. The presentation should follow a logical sequence for each of the goals and hypotheses. Goals should be linked to the methods that are linked to the results that are linked to the conclusions. The introduction sets the stage for your research question. What is the problem? Why is it relevant? What is known and unknown about the problem in the medical literature? What question do you intend to answer? What is your study hypothesis? The hypotheses are the anticipated answers to your research question. The methods section describes how you intend to answer the research question. Define the patient population, interventions, controls, outcomes, and study design using the PICOD format. Include a description of any new methods or measurement scales. The statistical methods section is the approach to analyzing the data that you obtain through your methods. This includes a sample size determination, descriptive statistics, and inferential statistics. Present your results in tables or charts if possible. Express your results in a quantitative measure of effect size, such as a mean or risk difference, rather than only as a qualitative measure, such as a p-value. For the outcome of decrease in systolic blood pressure 1 week after starting therapy with a new antihypertensive medication, don't present just the p-value of 0.04. Instead, the mean difference in systolic blood pressure at 1 week is a decrease by 20 millimeters of mercury for medication B compared to medication A, with a 95% confidence interval with a lower limit of 16 and an upper limit of 25. Interpret the confidence interval for statistical significance. The conclusion is an integrated interpretation of your results and not just a restating of the results. Compare your results to similar studies. What does your study add to the existing evidence? What are the limitations of your study? How did you address them? Finally, what are the implications of your study and future questions that remain to be answered? In summary, posters and platform presentations are an opportunity to present yourself and your work. There are also newer hybrid and virtual options. Advanced preparation and extensive practice are the keys to success. Follow the research timeline to anticipate conference deadlines. Read and then follow all instructions. Obtain peer review of your poster or presentation. On to our questions. Which is not a typical component of a platform presentation? Introduction, background, hypotheses, methods, results, conclusions, limitations, implications, or references? The answer is E, references. References are not typically included in a poster or platform presentation. Prior studies may be referred to in the study introduction and conclusions. The other responses contain the essential components of a poster or platform presentation. Your study found that 90% of seizures stopped within 5 minutes after treatment with anti-epileptic drug A and 80% after anti-epileptic drug B. How should your results be presented on your poster? Seizure cessation, AED-A, 90%, AED-B, 80%, risk difference of 10%, with a 95% confidence interval of 7% to 12%, or seizure cessation AED-A 90%, AED-B 80%, with a p-value of 0.04. The answer is A, risk difference with a 95% confidence interval. When possible, results should be presented as an effect size with a 95% confidence interval. This may be an absolute risk difference when the outcome variable is categorical, such as seizure cessation yes or no, as seen in the question, or as a mean difference if a continuous outcome measure is used. The effect size may also be expressed as a relative measure, such as relative risk or odds ratio. The effect size and confidence interval provides a quantitative and qualitative measure of statistical significance. P-values only provide a qualitative measure of statistical significance, whether statistically significant, yes or no. The next topic in the Pediatric Emergency Medicine Fellows Research Design course is manuscript submission.